And we all know him. He's fought in our liberation war, and nobody can forget that history. He's an academic of his own right. He has a doctorate, and he launched a book some months ago, and he's currently the Vice President of the country and Minister of Health. He is going to give you a brief. And,
the Deputy Minister of Health and Child Care, Mnangagwa, the Acting Secretary for Health and Child Care, Dr. Robert Mjigiradima, Director of Health Services, Metropolitan Seat of Harare, Dr. Prosper Jones, the Chief Coordinator of COVID-19 in the Office of the President and Cabinet, Dr. Agnes Maomba, Minister of Health officials here present, our esteemed frontline workers, ladies and gentlemen, members of the press, a very good afternoon to all of you. Hitherto, the Republic of Zimbabwe's COVID-19 statistics as of 17 February, that is yesterday, indicate that the cumulative confirmed cases rose to 35,423. New cases dropped sharply to 108, while deaths, whilst we don't want anyone to die in Zimbabwe, receded to 4. Meanwhile, active cases are pegged at 2,390, while cumulative recoveries stand at 31,615. The marked decline in new cases of coronavirus is vividly heralding the end of the second wave of the pandemic. Despite the slump, the government of Zimbabwe adopted a second line of defense to augment preventive measures to combat COVID-19. The second layer of defense is the procurement and rollout of COVID-19 vaccines, which you have all witnessed here. As you might be aware, that Zimbabwe received its initial batch of 200,000 vaccines from the People's Republic of China. Today marks the launch of the vaccination program that is set to achieve a herd immunity of at least 10 million Zimbabweans. The rollout program, which I've just mentioned, will be administered to all the frontline workers. That is the health services, ZIMRA, which is the Zimbabwe Revenue Authority, immigration officials, and the health staff of the security services. Just to mention a few of those frontline workers. We have got quite some small figures of the frontline workers in various other ministries.
Community ngoma unenge uchingonzwa vanhu vachitaura but it's more of my essay saka unenge uchingoita reassure kuti kana chabaiwa muchaona then mogutsikana sister zvitwa like now vachazviona mogutsikana kuti zvakamira sei and I don't believe kuti kungapuwa vaccine ingakanganisa munhu wese munyika. I think
chamungada kuudza vari ruzhinji rweZimbabwe kuti chipa
kudangoti vanhu ngavasununguke vabaiwe vaccine rauya ngavaritambire nekuti pakunonoka kutambira ndo pakusangana nedambudziko.
Mane nguva yakareba zvakadii muri kushandira
ndishandira mucity health ndiri nurse ndaka from 1999 but ndiri mucity of Harare from 2010.
Mushure mokunge mavaccinatiwa zvamaita sanhasi makuapproacha basa renyu sei zvinokupaiwo chingano chipi kuti basa renyu?
Zvinotipa confidence dzakanyanyisa ndikuziva kuti I'm protected. Also vanhu vachatedzera vachiona inini wacho ndakabaiwa saka vanogona kutambira zvakanakisa.
Okay, vaccine
to I think for the next week or so that we can build confidence in the population that they can also take the jab.
Okay, a lot of conspiracies were being said prior to the arrival of this vaccination. What really motivated you to brave up and say, no, let me just go and be among the first?
I've been reading about this Sinopharm. Yeah, so I don't see anything that would make me not want to take it, because I've been reading in other countries where it has been taken and there's not been that alarm that people are talking about. So it's about people making choices, and it's voluntary, and I've volunteered, and I'm ready for anything that comes with the jab.
Okay, so what's your message to Zimbabweans out there, probably those who are still hesitant to get the jab?
I think people should think twice about vaccination. We've been vaccinated against other diseases like polio, like measles, and it has worked for us. So if people want to be vaccinated against COVID-19, it's a personal decision, and I think they should reevaluate their thinking and maybe take what's best for them. Okay.